Good afternoon, dear patients. Today we will discuss the case shown in the picture, white spots on the head of the penis. We already had a video dedicated to a clinical case where the head of the penis was also affected and it was vitiligo. You can watch that in a separate video on our channel. But this time the case was different. The patient came in, he was 3 or 4 years old. Accordingly, over the course of 2 to 3 years, he began to notice the appearance of white spots in the area of the glans penis. Gradually, they increased in size. In the area of the spots, there was a slight burning sensation, some mild pain during sexual intercourse, and there were isolated areas of redness around the spots, especially, after sexual contact. Other than that, the patient had no complaints. He wanted to know what these white spots that appeared on the glans penis were, and they were shown in the picture. Accordingly, the patient was examined. During the examination, it was found, yes, indeed, that these were white spots on the glans. In the center of some spots, there was even a slight indentation. They did not rise above the level of the surrounding skin of the glans. And so, accordingly, that was the extent of the clinical manifestations. The foreskin was not affected. After the examination, this patient was diagnosed with pineal hemorrhage or sclerotrophic lichen planus. This disease is relatively rare. Its causes are not fully known. Essentially, these white spots are scars, in our case, on the glans penis. They are fairly superficial, but with significant trauma, they can ulcerate and cause considerable suffering for young men. In addition, what's quite unpleasant is that this is a disease of the genital organs, which carries a risk of developing cancer. That is why men are always recommended to undergo circumcision as a preventive measure against cancer. Accordingly, this disease is also sometimes associated with pathogens such as Borrelia burgdorferi. And naturally, all patients with lesions of the genitourinary tract are advised to be tested for sexually transmitted infections to rule out their involvement in such rashes. In particular, this patient underwent standard testing for sexually transmitted infections, including a smear and a panel of blood tests for syphilis and hepatitis. An antibody test for Borrelia burgdorferi was also performed. All of these tests came back normal. In some cases, when rashes are widespread, a comprehensive blood panel for connective tissue diseases is performed. However, in principle, this was a young, healthy man, and such studies were not conducted in our clinic. So the patient was prescribed topical anti-inflammatory medications. These are glucocorticosteroid creams. Then he was switched to Elidel cream. He was also prescribed low-dose prednisolone, ozone therapy, vascular medications, and drugs like longidasa. These rashes resolved by about 40 to 50%, after which the patient underwent circumcision, and accordingly, he was placed under ongoing observation for potential oncological changes.